Alright, this thing is frightening, but let's hear it. According to the American Cancer Society, prostate cancer is the most common cancer among American men. Now, before you panic, remember this. While it's a serious disease, most men who get it don't die from it. But it can still have a huge impact on your life and relationships. Let's talk numbers for a moment. In the USA, about 288,000 new cases of prostate cancer are diagnosed each year. That's nearly 790 men every single day. In the UK, it's around 143 men per day. These aren't just statistics. They are fathers, brothers, partners, and friends. Imagine waking up one day and realizing that the intimacy you've always known, the connection you share with your partner, might never be the same again. That is the reality many face when diagnosed with prostate cancer. It's not just about the disease. It's about the fear of losing a part of yourself, the anxiety of how your partner might react, the worry that you'll never feel normal again. Prostate cancer doesn't just attack your body. It can shake the very foundation of your relationships and self-image. But here's the thing, while it's a tough journey, it's one that many have walked before, and there's hope. So let's talk about it openly, honestly, and without shame. Because your sex life matters, your relationship matters, and you're not alone in this fight. Let's start by talking about treatment options. There's quite a range, from watchful waiting to surgery, radiation therapy, cryotherapy, hormone therapy, chemotherapy, and even vaccine treatments. For most guys with localized cancer, it usually comes down to surgery or radiation. Both have their ups and downs, so you'll want to have a good chat with your doctor about what's best for you. Now, if surgery's on the cards, here's a pro tip. Start doing Kegel exercises about a week before. Trust me, your bladder control will thank you later. It's simple. Just contract and relax those pelvic floor muscles. Think of it like trying to hold in pee when you really need to go. Yeah, I know, not the most glamorous image, but it works. Alright, let's get to the heart of the matter. How this affects your sex life. I'm not going to sugarcoat it. Prostate cancer treatment can throw a wrench in your sex life. You might deal with erectile dysfunction, a drop in your sex drive, changes in how orgasms feel, or even a decrease in size of your penis and testicles, especially if you're on hormone therapy. But here's the thing, it's like recovering from any other injury. You wouldn't expect to run a marathon right after breaking your leg, would you? Same principle applies here. It's a process and it takes time, but don't lose hope. There are solutions out there. You've got options like vacuum therapy. Yeah, it's basically a pump for your penis. Sounds weird, I know, but it can be effective. Then there are penile injections. Now, before you cringe, hear me out. It's a tiny needle and it has 90% success rate. For some guys, penile implants are the way to go when other options don't cut it. And of course, there are medications your doctor can prescribe to help you with erections. Remember, sex isn't just about penetration. This is a great time to explore other ways to be intimate. Touching, caressing, using toys, get creative. It's all about rediscovering intimacy in new ways. Now, if you're planning on having kids in the future, make sure you talk to the doctor about sperm banking before treatment. Prostate cancer treatments such as surgery and radiation can affect fertility, but a little planning can keep your options open. For those of you watching who are supporting a partner with prostate cancer, your role is crucial. You can't fix cancer, but you can be there. Show love, be patient, and remember you're in this together. Living with prostate cancer is a journey, and your sex life is part of that journey. It might change, but it doesn't have to end. Be patient with yourself, communicate with your partner, and don't be afraid to ask for help. It's all about taking it one step at a time. That's all for today, folks. If you found this helpful, give it a thumbs up and subscribe to my channel. Hit that bell icon to stay notified, and until next time, stay safe, folks.